Welcome, everyone. Thank you for joining us for another installment of Coffee Chats. I'm your host for today, Wendy Poischbeg, Vice President of Economic Development for Economic Alliance, Snohomish County. We'd like to remind you all joining us today via Zoom to please mute yourself upon entry and drop your name and organization in the chat. Today, we welcome representatives from Washington Cares Fund and the Employment Security Department to delve into the specifics of the Washington Cares Fund and what that means for you, our viewers. Joining us speaking on this topic today are Kristen Maki, Community Relations and Outreach Program Manager at the Washington Cares Fund, and Thelma Perry, Customer Service Specialist Lead at the Employment Security Department. Thank you both for being here. Before we dig into the specifics of the Washington Care Fund and answer your questions, Kristen Maki is going to provide our audience today with a presentation outlining the Washington Cares Fund. Kristen, the floor is yours.
Thank you so much, and really appreciate the opportunity to be here and talk about the program. I'm going to go ahead and share my screen. So I want to start by defining what we're talking about when we say long-term care or caregiving in reference to a program like WA Cares. Long-term care is help with activities of daily living like bathing, eating, dressing, preparing meals, grocery shopping, and more. It does not include medical care like doctor's visits and treatment for medical conditions. It covers a broad spectrum of needs and circumstances, including for younger people who have been unexpectedly injured or become disabled or ill. And a lot of people don't realize what a broad range of services can be included when we talk about long-term care. We often think of it as care in a residential setting, like a nursing home or assisted living, but it can also include care provided in your own home. And in fact, most people with long-term care needs can stay in their own homes with the right support. It's also very common for family caregivers to not realize that they are a caregiver. You might go to your mom's house a couple times a week to cook meals, drive her to appointments, make sure she's taking her meds. And all of those things are common care activities. And the majority of this type of care is provided on an informal basis as unpaid care from a family member, a friend, or a neighbor. And before we dig into details of the program, I also want to talk briefly about why the program is needed, which is in short because the way that we have paid for long-term care up until now isn't working. Even though 70% of us will need long-term care at some point in our lives, most of us can't afford it. The annual cost for 20 hours of home care per week is just under $36,000 per year, and other types of long-term care are even more expensive. But the median household income for Washington seniors, and that is household, not individual, is just $56,000 per year. And that means that in most situations where someone needs care, family caregivers have to step in to fill the gap, either with their own savings or by providing unpaid care. Almost half report a related financial setback, and they spend an average of 25% of their own income on care-related expenses. Many even have to leave the workforce early in order to provide care, and caregivers 50 and older who do this lose an average of more than $300,000 in wages and benefits. Businesses in the economy are impacted as well. Most caregivers work full-time, and over 60% of working caregivers say that their care responsibilities impacted their job in some way, often having to come in late, leave early, reduce hours, turn down promotions, quit, or retire early. And when a working caregiver leaves their job, it can cost up to 1.5 times their salary to replace them. So in developing a solution to this problem, there was a lot of research done by the legislature, both in Washington, as well as looking at national think tank research on this topic. This is all found that a universal public insurance design like WA Cares is the only way to cover the broad middle class affordably. So they looked at voluntary private insurance and found that with even subsidies, private insurance could never cover more than 15% of the population. So WA Cares was really designed in order to cover the broad middle class at an affordable premium in a way that is sustainable over the long term. So let's talk about how the program works. WA Cares is a universal long-term care program in Washington State. It's an earned benefit, so you contribute for a certain number of years in order to qualify for benefits. It's entirely self-funded by worker contributions, which go into a dedicated trust fund that's only used for this program. Workers contribute 0.58% of each paycheck to WACARES, and you can see here what this looks like for the typical worker who makes just over $50,000 a year and would contribute $291 each year, or about $24 per month. You only contribute to WACARES while you're working. Contributions stop when you retire or if you become unemployed. Everyone is covered at the same rate, regardless of pre-existing conditions. And when it comes time to claim your benefits, there are no copays or deductibles. You don't need to file claims and front payment for services. Instead, we connect you with contracted providers for the services that you want, and we pay them directly. Contributions to the program have now begun this month in July 2023, and benefits become available in July 2026. This is what those contributions can look like over the course of a career. You can see that the typical Washington income is just about at the level in green here in the middle. And you can see that that $290 in contributions each year totals out at $8,700 over 30 years. Almost all Washington workers contribute to WACARES. Here is a breakdown of the exceptions. Some workers are automatically not included. Federal employees are excluded. Employees of tribes are only included if the tribe has opted in, and self-employed people are only included if they opt in. There are also other workers who can get an exemption, which they must apply to the Employment Security Department to get. There are 3 types of optional exemptions that are based on meeting certain conditions. So that's the first 3 listed here. That's for workers who live out of state, temporary workers with non-immigrant visas, and spouses or registered domestic partners of active duty military. And these 3 exemptions were created for groups of people who would be unlikely to qualify for or be able to use their benefits. They are available on an ongoing basis and are conditional. So the person must continue to meet the exemption criteria to maintain their exemption. There are also 2 types of permanent exemptions. So veterans with a 70% or higher service-connected disability rating, and this is a group that has access to some nursing home care through the VA, can choose to apply for a permanent exemption. These applications became available January 1st of 2022 and are available on an ongoing basis. There was also an exemption available for workers who had private long-term care insurance before November 1st, 2021. These applications are no longer available, but under current law, any workers who already have an approved private insurance exemption will continue to be exempt permanently. To apply for an exemption, workers can start by visiting wacaresfund.wa.gov/exemptions for detailed instructions and a list of documentation required for their exemption type. They will need to create a Secure Access Washington account if they don't already have one. And they will follow the instructions on our website to add a new service and complete the application. ESD will review the application and send an approval letter if the worker's exemption is approved. And then they will need to provide the letter to their current employer and any future employers. And if they have an conditional exemption, then they will need to make sure to notify their employer and ESD within 90 days if their situation changes and they no longer qualify. And anyone who is submitting applications for exemptions for those 4 ongoing exemption types, after this point, those exemptions are going to become available, or I'm sorry, effective on or after October 1st, because it's done on a quarterly basis. Then let's talk about qualifying for coverage. Anyone who is contributing to WACARES more than 500 hours per year is earning benefits, and that includes part-time and temporary workers. So that's about 10 hours per week. And then by contributing for a certain number of years, you qualify for the benefit. And there are 3 pathways that you can use to meet the contribution requirement. The first is early access, which is for workers who have not yet earned lifetime access, but have a care need either while they're working or soon after they leave work. And that is for folks who have contributed 10 years, for 3 of the last 6 years at the time that they apply. Then we also have lifetime access, which is how we expect the vast majority of workers to qualify for the benefit, and that's for folks who have contributed 10 years without a break of 5 or more consecutive years. Then we also have a special pathway for near retirees. This was created in 2022 by the legislature. So anyone who is born before 1968 and is therefore unlikely to qualify for the 10 years pathway will earn 10% of the benefit amount for each year that they work. So for example, if you work and contribute for 500 hours or more per year for 3 years, you'd earn 30% of the benefit amount, or just under $11,000. Or if you are retiring at the end of this year, as long as you work 500 hours after contributions start in July, you can retire at the end of the year and still earn 10% of the benefit amount. Near retirees will have access to whatever percentage of the benefit amount they earn at any time that they need care. And then they're also able to qualify through one of the other pathways if they meet those requirements instead. Once workers meet the contribution requirements and need help with at least 3 activities of daily living, they can get access to a $36,500 budget for services and supports. And that benefit amount will increase over time with inflation. It is a lifetime amount. And with Walk Cares, workers get the flexibility and freedom to choose the services and supports that meet their needs. So that could mean in-home or residential care, but it could also include home modifications to make their home safer, assistive technology for things like medication reminders and fall detection that can help with some care needs. And really, the program is designed to help people age in place in their own homes as long as possible. That's what almost all of us want to do, and what most of us are able to do as long as we have the right supports in place. Then Walk Cares is also really structured to support family caregivers. So you can choose someone who would otherwise be caring for you on an unpaid basis to get training and be paid, even your spouse. So Walk Cares can help lessen the impact on family caregivers by paying them for their time or making sure that they can get other support services. We get asked a lot about how far that benefit amount will go. It won't cover 100% of care for everyone, but it would cover the amount of in-home care an average Medicaid client uses for roughly a year. About a third of people need care for a year or less. So for those people, depending on the type of services they get, Walk Cares may be able to cover all the care that they need. And for others, Walk Cares provides the family with immediate relief and time to plan for future care costs. I won't go into too much detail here, but these are just some examples of how someone might use their benefit. So you could pay a family caregiver to care for you for about 10 hours per week for 2 years and get care supplies. You could choose services to help you stay safely in your own home and purchase $15,000 worth of renovations like bathroom modifications or a wheelchair ramp, get an electric wheelchair or scooter, and have meals delivered for 3 years. Or for someone who needs long-term care due to an unexpected injury, you could get 20 hours of in-home care per week for a year, plus transportation to appointments and supplies like crutches. Next, let's talk about employer responsibilities. Employers do not contribute to Walk Cares, only workers do. Employers are required to maintain a record of all employees who have submitted an approved exemption letter, and they are required to collect premiums, starting with any paychecks issued on or after July 1st. And then they must report employee hours and wages and remit premiums to the Employment Security Department each quarter. Walk Cares uses many of the same definitions as the state's paid family and medical leave program. So if a worker is included in paid leave, they will also be included in Walk Cares unless they have an approved exemption. ESD is also using the same wage definition as they do for paid leave. However, unlike paid leave, the income to which Walk Cares premiums are applied is not capped at the taxable maximum for Social Security. It is the employee's responsibility to apply for an exemption and provide their employers with their approval letter. Employers must keep a copy of the exemption approval letters they have received from employees on file. And once the employee provides their approval letter and the exemption effective date has passed, then the employer will stop withholding premiums for that employee. If the employer continues to withhold premiums after the effective date, they must return premiums to the employee. They are not required to stop withholding premiums until they receive a copy of the letter from the employee. And you can see what those exemption letters look like over here on the right. You can see that there is an exemption date, effective start date on all of those. Employers are also required to deduct premiums from each paycheck an employee receives on or after July 1st. So the premium is 0.58% of the employee's gross wages. And ESD does have a calculator on the paid leave website at paidleave.wa.gov that employers can use to calculate both paid leave and WA Cares premiums. Employers will report employee wages and pay premiums for WA Cares on a quarterly basis using the same process that they currently use to report paid leave premiums. So that reporting system is being updated so that employers can report for both programs at the same time. The first report and payment that includes WA Cares premiums will be due October 31st, 2023 for July, August, and September 2023 payroll. And you can see on the right column what information employers are required to report. Note that ESD recently adopted rule changes that add each employee's date of birth to the reporting requirements and to require employers to report even in quarters where they have no payroll. So this will be effective for reporting starting in Q3. Also want to just share a couple of resources that are available on our website. We do have an employer and community toolkit with lots of materials that you can use to communicate about WA Cares. We know many of you are getting questions even now that contributions have begun and want to make sure that you have the answers and resources that you need. So the toolkit includes a calendar and recommendations for how and when employers can use toolkit materials. This was really designed for the lead up to contributions beginning. So we are working on some updates to those materials to ensure that we have evergreen long-term recommendations available. But we also have a paycheck insert, FAQs to be able to answer questions, and long content that can be used for all staff emails or blog posts. We have some materials that are really designed for community and professional organizations, but may be helpful for businesses as well, like social media graphics that cover different aspects of the program. And we also have a fact sheet, infographic, and posters that are available in many different languages. If you have any workers who English is not their first language. And then we have a ton of video content, including animated explainers, some new FAQ videos. So if you haven't checked out our resources recently, you should take a look at those. And then we have program overview videos, recordings of past webinars, and all of these materials are available on our website at wacaresfund.wa.gov/toolkit. And that is what I have for you for the presentation. We do have someone else from ESD joining us to be able to answer questions. Thelma was unable to join. So Rory Summerson is going to be able to help out if you have specific questions about exemptions and employer responsibilities.
Okay, great. Thank you. Thank you. That was really incredibly informative. As somebody who has just been through long-term care with an aging parent, I can't tell you how helpful this is. And so I'm incredibly grateful. I want to start off our Q&A with a question from the chat. One of our participants is a sole owner of an LLC for employees and file as an S Corp. Are they personally required to contribute, or are they considered self-employed and required to opt in?
Rory, do you want to take that one?
Yeah, absolutely. Hello, everyone. My name is Rory Summerson from ESD. And so in a situation like that, we're going to be basing it off of the DOR filing. So if the DOR has them listed as a corporation, they would be responsible for withholding for themselves and reporting. If they're not, if they're listed like the S Corp or as an LLC, then they would have the ability to elect coverage.
Okay. Thank you for that. I forgot to mention that as we do the Q&A portion, we're focusing the questions on how to educate our businesses and our communities on the requirements of the Washington Care Act, which is now law. We're not debating the law. And we also ask that you put your questions in the chat and remain focused about the implementation and the process. One of our other questions are, what resources and supports are available to businesses in Snohomish County to navigate the administrative aspects of the long-term care initiative?
So we do have the employer and community toolkit that is available on our website. But in terms of like the more technical aspects, reporting, I would check out both the Walk Cares Fund website as well as the paid leave website, because you are doing these reports together. There is a lot of great information on the paid leave website that is also applicable to Walk Cares. So I think those two places are the main resources that we have available. Is there anything else you'd point to, Rory?
I could find my mute button. Apologies for that. I would also say, you know, anytime that you have more direct or specific questions that are unique to your situation, our staff is readily available by phone call. We do encourage giving us those calls. We can walk you through the more specific issues that you may be encountering or more specific questions. In terms of a need support, our specialists can also walk you through setting up your CSVs for reporting and walking you through some of that additional information as well.
Okay. So how will the state monitor the effectiveness and financial stability of the Washington Cares Fund over time? Will there be mechanisms in place to adjust contribution or benefits if necessary?
Yeah, we do have mechanisms in place for that. The LTSS Trust Commission, which is our governing body, is charged with working with the Office of the State Actuary on an ongoing basis to do actuarial analysis. They have already completed some of those projections for the fund kind of going forward, and we'll continue to monitor that, make adjustments to ensure that the fund remains solvent, and to advise the legislature on any changes that may be needed to the program in order to ensure that that happens.
Okay. Can you clarify the eligibility criteria for employees to access the benefits of the Washington Care Funds? Are there any specific conditions that employees need to meet, and how will the claims process work?
Yeah, so a few things there. We did talk a little bit about that in the presentation on the slide with the 3 pathways. So that is the first requirement. There is both a contribution requirement and a care needs requirement. So you need to have contributed to the fund for enough years to meet those contribution requirements we talked about. So that's either 3 of the last 6 years at the time you apply, for 10 years without a break of 5 or more consecutive years, or if you were born before 1968, you just need to have worked at least 1 year and you will have earned a prorated benefit. And then the care needs requirement, we're still working on what the exact details of that process is going to look like, but essentially we will have an eligibility assessment to just work with you and understand what kind of care needs you have, and be able to assess that. And once we've determined that you do need help with at least 3 activities of daily living, then you'll be able to access your benefit amount. So you will be able to work either through our website or by calling our customer care staff to identify a provider that provides the services that you're looking for. You have a choice of what services you'd like to receive, and you pick a provider. You'll authorize them to provide those services using your benefit, and then you'll be able to get those services.
So if somebody only meets 2, like I can't feed myself, but I don't need equipment, or they may have 2 things, can they access portions of their benefit, or you have to have 3 or more?
You have to have 3 or more, but in practice, a lot of these kinds of activities of daily living kind of go hand in hand. So you may need help with dressing. If you need help with dressing, you probably also have some mobility issues and need help getting around the house. And so a lot of those things are paired together. It is, you know, compared to some of the other standards for like private long-term care insurance, it is a little bit of a lower bar. So hopefully we're able to help people at an earlier point in their care journey.
Okay, good. So what about businesses that have employees who work remotely or across different states? How will the long-term care initiative apply to them? Will they be subject to the same requirements?
Rory, do you want to take localization?
Yeah, so for localization, if the work that they're doing is based in Washington, they would be part of the fund. One of the easiest ways that we share out that people can kind of indicate whether or not an existing employee is part of the fund is whether or not they're paying into the paid family and medical leave program. Both programs use the same legal definitions for the relationships between an employee and an employer, the definitions for wages and remuneration, as well as the definitions for localization. So if you as an employer have localized that worker to Washington, then they would be participating into the program. If they were working for you and you had not localized them to the state of Washington, much like PFML, they would not be paying into the program.
Okay. Are there any tax incentives or benefits for businesses that already provide comprehensive long-term care insurance to their employees? And how will this impact their obligations under the new initiative?
So that's not part of the law at this point. And in terms of their obligations, they are still required to follow those kinds of employer responsibilities of collecting premiums from any employee who has not provided an approved exemption letter, reporting those premiums.
What if an employee leaves the state after paying in for a certain amount of time? What happens to the benefits they've accrued in the fund to date?
So right now, under the current law, you do need to live in Washington in order to receive the benefit. And that's because we are the first state to develop a program like this. All of the providers have to be contracted with the state. Each state has different laws on what makes someone qualified to provide long-term care. So in order to have a benefit where we're able to pay providers in other states, that requires us to develop a program that is essentially a national program. And that is something that is still under consideration. So the LTSS Trust Commission, which is, again, our oversight body, recommended to the legislature in its report this year that WACARE's benefits be made portable for people who have met the contribution requirements but moved to another state before they need care. So that is up to the legislature at this point. And if the legislature does make changes to the law, we will communicate that information out to employers and workers.
Excellent. This is such great information and so helpful. Do you want to end with any additional remarks, either you or Rory?
Rory, did you have something you want to share?
Just that I saw that there was the one question in the chat, so I wanted to make sure that we got to that one more vocally as well, in terms that do workers work less than 500 hours still contribute to the program? And the answer to this, the simplest answer to that is yes. Basically, hours are cumulative across employers. So if they don't reach 500 hours with one employer, they might with multiple. And so, yes, they would still contribute even if they're not working 500 or more hours with a single employer. So I wanted to make sure we touched on that. Other than that, though, just the reminder that our phone lines are open. We're always there to support, and we do encourage people calling us if they have any questions at all that we haven't answered in a forum like this.
Okay, excellent. Thank you. Again, I'd like to thank both of you for joining us today to discuss the Washington Cares Fund. For those who registered for today's installment of Coffee Chats via Eventbrite, check your inbox later today for a list of resources from the discussion, as well as a link to the recording should you wish to rewatch or share it. And before we go, I'd like to highlight a few events coming up for EASC. On Tuesday, August 8th from 8:30 to 9:30, EASC and the Washington State Department of Commerce are partnering to bring you a discussion on strategies for employer-supported childcare. Childcare remains a key issue impacting our workforce. During the coffee chats, we will cover strategies and ROI tools to help employers consider and assess how to better support working parents and communities. Sorry, my dimmer went off. RSVP to this free virtual event by scanning the QR code on your screen or visiting economicalliancesc.org. And then on Thursday, August 24th, join us from 4 to 7 p.m. at the Edmonds Waterfront Center for the summer networking presented by Alaska Airlines and the Boeing Company. You do not want to miss the hottest networking event of the summer, celebrating Alaska Airlines' daily year-round new route to Honolulu from Painfield. Food, drinks, music, games, a 360-degree photo booth, and more. You can get your tickets by scanning the QR code on your screen or visiting economicalliancesc.org. To conclude, please get your coffee mugs ready and let us adjust to the gallery view. I'm in the dark, but we would love to see all your faces. Now let's raise our coffee and cheers to another great discussion. I'm celebrating with Everett Community College this morning, and I thank you all for tuning in. Until next time. Thanks, everyone. Nice to see you, Rory. Thanks, everyone. Thank you, Kristen.